Let us now start for the neurological assessment. The purpose of this is to detect neurological disease or injury of the patient. Let us now start assessing it. The cerebral function. Check client's behavior. The facial expression is the client is happy. The posture is comfortable. The grooming is cramped. We will now check client's LOC or level of consciousness. What time is it right now, ma'am?
It's already 9:23 in the evening.
Where are we right now?
At the clinic.
Who were with you?
My aunt.
What are you performing today?
Neurological assessment.
So now we will check client's mental status and cognitive function. Let us start first from the immediate memory. Can you please repeat 333, ma'am?
333.
10, 10, 10, 10, 10.
10, 10, 10, 10.
So now proceed to the recent memory. Ask client to 2 appropriate questions. What did you eat for breakfast?
Ham, egg, hot dog.
Who were with you?
My aunt.
Now we'll proceed to the remote memory. Ask client to state birthday. When is your birthday, ma'am?
November 18, 2004.
Where did you last celebrate your birthday?
At our house.
The mathematical ability. Ask to solve simple addition or subtraction. Can you please add 5 plus 3, ma'am?
8.
7 minus 2.
5.
General knowledge and vocabulary. Ask 2 general questions. When is the Bonifacio Day, ma'am?
November 30.
How many days in a week?
7.
Abstract thinking. Ask to interpret. Can you please interpret time is gold, ma'am?
Time is gold because time is a valuable resource.
Judgment. So if there's a will,
There's a way.
so now let us proceed for the communication. Test speech and language. So as what I've observed from the client, the speech flows easily and enunciates clearly. The motor speech. Can you please sing Do, Re, Mi?
Do, re, mi, fa, sol, la, ti, do.
The automatic speech. Say the months.
January, February, March, April, May, June, July, August, September, October, November, December.
The sound recognition. Can you please close your eyes and then clap? The auditory verbal comprehension. Can you please put your hands and lock together? The visual recognition. Can you please identify what is it? Can you please identify that?
Earphones.
Visual verbal comprehension. Can you please read this to me?
Don't judge a book by its cover.
And explain.
Because looks and appearance doesn't define who we are. That's all.
Client's writing. Can you please write your name, ma'am? And raw figures like square, star, circle. We will now assess cranial nerves. The olfactory. Ask to close eyes. Ask to identify substance and perform both nose rays. Can you please identify what substance is this now? What substance is this?
Lotion.
Next.
Lotion.
Next is the optic, oculomotor, trochlear, and abducens. We will test visual acuity, peripheral vision, and pupil accommodation. So the visual acuity is intact, the peripheral vision is intact, the pupil accommodation is in PERRLA, which is the pupil equal round reacting to light accommodation. We will now proceed to the oculocephalic reflex. We will hold the head with two hands, rotates head from side to side, and palpates for contraction of temporal and masseter muscles. Palpates for the temporal and masseter area. Now, we will proceed for the trigeminal, the motor function. We will instruct the patient to move jaw from side to side and clench the jaw. Palpates for temporal and masseter. Can you please move your jaw now from side to side? Clench your jaw. Then I will palpate the temporal and the masseter area again. The sensory function. We will instruct the client to close eyes and we will touch the jaw, cheeks, and forehead with cotton wisp. And instruct to verbalize sensation as well. Repeats the procedure using technique. Can you please close your eyes now and tell me if it is sharp or light? Sharp or light?
Light.
Tell me.
Light. Sharp. 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 Sharp.
Okay. We will now proceed for the corneal reflex. Touch the cornea with cotton wisp. So now we'll proceed to the facial. Can you please smile for me now? Frown. Raise your eyebrows. Show your upper teeth. Lower teeth. Puff out cheeks. Purse lips. Close eyes tightly. We'll now proceed for the taste test. Can you please tell me if it is sweet, sour, or salt? Salty now.
Sweet.
Salt.
Oh my god. Sour. My god.
Now we'll proceed to the acoustic. Perform Weber test. We will use appropriate tuning fork. Hold tuning fork by stem. Tap tuning fork prongs. Place vibrating tuning fork in the middle of patient's forehead. Ask to which ear hears louder. So assuming that this is a tuning fork, which part of your ear hears louder now?
Right.
Now we will perform Wien's test. Taps tuning fork, instruct to verbalize when sound is no longer heard. Place vibrating tuning fork as on mastoid process of right ear. Next, we will perform Robert's test. Instruct to stand with feet together, eyes open, and then close. Stand close the patient, notes patient's ability to maintain balance. Can you please stand up, ma'am? And eyes open, and then close. Next is glossopharyngeal and vagus. Observe patient's ability to swallow, cough, and tongue, and test bitter taste. Can you please swallow, ma'am? Cough, and say ah. And I'll test the bitter taste. Tell me this is it. Now the accessory. Instruct to shrug shoulders upward against resistance, as to turn head from side to side against resistance. Can you please shrug your shoulders upward? Wisa. Next is the hypoglossal. Can you please say D, L, and T, ma'am?
D, L, and D.
Protrude your tongue. Move tongue side to side. Next is the sensory assessment. Assess superficial sensation, light touch sensation in the upper extremities, torso, lower extremities, and instruct to verbalize if sensation is felt. Can you please tell me if it is light touch? Next is the pain. We'll use toothpick with a skin with dull end and skin with sharp end. Applies it randomly, instruct patient to verbalize. I will use toothpick, the sharp end and the dull end. Can you please tell me if it is sharp or dull, ma'am?
Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Next is the temperature. Test sensation to warm. Cold, ask to identify temperature. Can you please tell me if it is cold or hot now?
Cold.
Cold. We will now assess deep sensation, the vibration. We will use tuning fork, place it over a finger joint and the tooth joint. Instruct to verbalize if vibration is felt. Can you please tell me if the vibration is felt now? we will proceed to the kinesthetics. Hold fingers on side and move up and down, and instruct to identify direction of movement. Flexes patient's big toe and instruct to move up and down. Can you please give me your fingers now? Can you please tell me if it is up or down? Next is the we will now assess discriminatory sensations, thus diagnosis. Instruct to close eyes. Place familiar object on patient's hand and instruct to identify object. Test both hands using different objects. Can you please close your eyes now? So, give me your hand. Here. Can you please tell me what are you holding?
Both hands.
The next one. Next is the grapisthesia. Instruct to close eyes. Place number on patient's hand. Instruct to identify the number. Test both hands. Can you please close your eyes now? And then open. Give me your hands. Can you tell me what number is this? 2.
3.
Now we will proceed to the reflexes. Assess deep tendon reflex. The biceps. Rest the elbow on nurse's non-dominant hand. Place thumb over biceps tendon. Strikes own thumbnail by reflexon. Assuming that this is a reflexon. And strike the biceps. This is the biceps reflex. And then the triceps reflex. We will now proceed to the brachioradialis. Supports patient head with non-dominant hand, palpates the brachioradialis tendon 3 to 8 cm above. Simultaneously strikes styloid process of radius. Can you please give me? This is the brachioradialis reflex. Next is the patellar. Instruct patient to sit with legs down. Strikes tendon directly below patella. Come here now. This is the patellar reflex. Next is the Achilles. Instruct patient to lie, supine or sit with one knee flexed. Holds patient foot slightly dorsiflex. Strikes Achilles tendon. Please come here now. This is the Achilles tendon. We will now assess superficial reflexes. We will now start for the abdominal. Strokes patient's abdomen diagonally from upper and lower quadrants towards umbilicus. Can you please lie supine? Next is the plantar reflex. Strokes sole of patient's foot in an area from lateral heel to medial bump. This is the plantar reflex. Next, we will assess meningeal signs. The Koenig sign. Instruct to lie supine with one leg flex. Try to extend leg. Applies pressure to client's knee. Can you please relax now? Next is the bruising kiss. Instruct patient to lie supine, flex head, chest, observe hip flexion. And please relax, ma'am. So now, that's all for our assessment. After that, we'll perform hand hygiene again and document.
I know.